I'm Dr. Derek Farr. I'm an orthopedic surgeon in Ocala, Florida, and I'm board certified, fellowship trained in sports orthopedics. So prehab is kind of a new concept. I think we all were focusing on rehab after surgery. You know, the X10 is a device that we've used, and I think that's something that's going to help enable patients to get stronger prior to surgery, help them regain motion after surgery, in addition to hands-on physical therapy. And I definitely think it's a good option for a lot of patients.
I'm Joseph Salama. I'm a physician, and I'm an orthopedic physician. Recently, we've been familiar with the X10 machine, and my experience with the X10 machine has been tremendous. I've tried it on myself. It is a great tool to have. The patient is actually the driver in here. He actually or she actually drive the motion, and the machine will help enhance that without causing them pain. They've been delighted with that machine. Their range of motion has been substantially improved. Their quicker rehab, even as an outpatient after the X10 machine has been used, and the patients are very satisfied and very happy with the outcome. If they are happy, I am happy.
My name is Lisa Alarcon. I work for Family Home Health Services, mostly out of the Plymouth branch. In getting that knee motion faster, which we can do with the X10, getting the swelling out faster, which we can do with the X10, on top of the more frequent therapy, what we're seeing is significantly shortening what that painful window is. Now we have a better guarantee, if you will, or we can promise them at least a little bit that, hey, this course of treatment is going to be shorter and less painful than it would have been before we had technology like the X10.